Judith, and we have been working with this hip leg pain for what, a few months. You've been dealing with this for about a year, haven't you? Okay. And for some reason, we cannot remove it. You even had back surgery, didn't you?
Yes.
And they thought that something was going on with your vertebrae, sciatic nerve. Okay. Curvature of the spine, but that's not her. Most intense pain is in this area and this area. So I am slowly working here. And I hit a hot spot, and a super hot spot, so I'm just going to gently sneak this in there. Okay, good. How we doing?
Okay.
Mm-hmm. And I am working on this IT band, and I'm working on her quadricep and her hamstrings too, because I don't know which one it is. She's just so everything is on fire, and it's just hard to determine what to do. So I'm just going to work on all of it. And you see I'm poking holes. Let me know when you're ready. I kind of pinch the skin to distract some people so that I can get the needle in so that they don't have to go through the pinch. Now she's very, very thin, and so I'm trying not to go all the way down to the bone. Although that may be where I need to go. But the other part of that is I'm going to use some, oh, there it goes, okay. You okay? Now, this is probably my most difficult case these days, and for some reason I've tried to sedate her, I got my laughing gas, and nothing seems to make her comfortable enough or I can really go in and agitate, because her eyeballs pop out. So I have to be very, very, very gentle and careful. Pinch. So every time she comes in, I apply about at least 100 pounds of effort. And 100 pounds of effort is all of my tools. As I'm doing this, I can feel her bone. So I'm making contact, so that means I'm getting the full breadth of the muscle. How are we doing, Miss Judith?
I'm okay.
Okay.
Time to breathe.
Okay. You can see the IT band there. The idea behind prolotherapy is that you go for the ligament. The idea behind trigger point is that, muscle injection is that you focus on the muscle. The idea of some other injections is that you try to find the tendon-muscle junction. All those are concepts that you cannot figure out, period. So you go for the whole thing, stem to stern, top to bottom, origin to insertion. That way you don't put any human concept into it. You just do what you have to do. If you don't do it, it won't get done. So this is what I call my combination. It's every concept all in one. So you go from origin to insertion, the depth, you go the breadth, you go the length, and you spend the time. Sometimes it's not even necessary. But in this case, I have to. Oh, you're okay. You're okay. Now I'm going to get this hamstring right there. You okay? Does it seem like it's quieting down at all? Not really. Got to be honest.
I'm trying to think down closer towards my knee.
Mm-hmm.
The tingling and what went on is abating.
Okay, good. Okay.
Further up my leg, which you haven't been to yet,
Mm-hmm.
they'll touchy.
Okay.
They'll
Okay.
not touchy.
Okay. Okay. I understand. And now realize what you just did. You tried to explain your pain, and in this situation, pain is just ouch. It's just where it hurts. You're not obligated to try to figure out or classify it.
Oh.
Pain is just pain. It's just pain, and you apply the treatment to the pain site. The idea of trigger points, tender points, IC points are all irrelevant. It's just where it hurts. Now I'm going to do this in, so let me go back up here. And I'm looking for tender. That's a little ropey in there, but she's so thin. Anything here?
A little bit.
Okay, that's her. That's her trochanter. I'm gonna go below there. Anything here?
Only thing I can tell you is that it feels good.
Okay, good. Anything
Oh,
here?
that.
Okay, that's it. Okay. So now it's impossible. Literally, I'm talking to the camera. It's impossible to determine if that's a trigger point, tender point. It doesn't matter. You have to treat it. You're obligated to treat it. If you don't treat it, you're doing an incomplete treatment. And an incomplete treatment harms the patient. So we don't want to harm patients. Pinch. Now, Miss Judith, I'm going to send this to Medicare because they have no idea of the pain that you're in. I don't think they care about the pain that you're in. But hopefully someone there will see this and understand how complicated it is. Now, how simple it is, but how time intense it is. Because they think that it's lickety-splitty. Wham, bam, thank you, mammy. Easy peasy. That's what they think. So I'm going to let those soak in, and then I just need you to try to stretch as much as you can, and then in about 10 minutes I'm going to come back and do another layer, okay?
How do you want me to